Blind pimples. Causes, treatments, and prevention tips. Blind pimples, those painful underground bumps that form beneath the skin's surface, are a frustrating reality for many. Unlike whiteheads or blackheads, these pimples don't come to a head, making them difficult to treat and incredibly tender. Understanding why they happen and how to deal with them is key to preventing them from ruining your day. What exactly are blind pimples? A blind pimple is a small, inflamed lump that develops under the skin, usually on the face, chest, or upper back. It doesn't erupt like typical acne, remaining hidden beneath the surface. This makes it hard to pop, and you shouldn't try, because squeezing can worsen inflammation and even lead to infection. Blind pimples often feel like hard, painful knots. They're essentially a deeper form of cystic acne, where excess oil, dead skin cells, and bacteria become trapped deep within the hair follicle. These deep blockages cause inflammation and pain because they're close to the skin's sensory nerves. Why do blind pimples hurt? The pain comes from the deep buildup of pus and bacteria pressing against sensitive nerve endings. Unlike surface-level pimples, blind pimples don't have an easy escape route for this pressure, making them significantly more tender. What causes blind pimples? Like all acne, blind pimples start with clogged pores. Excess sebum, oil, dead skin cells, and bacteria combine to create a blockage deep within the follicle. Factors contributing to this include hormonal fluctuations. Puberty, menstruation, menopause, or even stress can increase oil production. Genetics, a family history of cystic acne increases your risk. Poor skincare, using comedogenic pore clogging products can exacerbate the issue. Diet, high glycemic foods and dairy may trigger inflammation. How to get rid of blind pimples. Treatments that work. Blind pimples aren't quick fixes. Patience is essential. Here's a breakdown of effective treatments. Warm compresses. Apply a warm washcloth for 10-15 minutes, several times a day. This encourages the pus to surface, potentially turning the blind pimple into a regular pimple that's easier to treat. Niacinamide. This ingredient reduces inflammation and may help control oil production. Incorporate a niacinamide serum or moisturizer into your routine. Benzoyl peroxide kills bacteria and reduces inflammation. Use a topical treatment, but be cautious if you have sensitive skin. Hydrocolloid patches. These patches absorb pus and protect the pimple from picking. Steroid injections. For severe cases, a dermatologist can inject a steroid directly into the pimple to reduce inflammation. Preventing blind pimples. A proactive approach. Prevention is always better than treatment. Here's how to minimize your risk. Skincare routine. Use a non-comedogenic cleanser, a salicylic acid or benzoyl peroxide treatment, and a lightweight moisturizer. Avoid pore-clogging products. Check ingredient lists for comedogenic oils and waxes. Dietary adjustments. Limit high glycemic foods, dairy, and processed sugars. Manage stress. Stress hormones can trigger breakouts. Consider prescription medications. For persistent acne, a dermatologist may recommend oral antibiotics, isotretinoin, or spironolactone. When to see a dermatologist if over-the-counter treatments aren't working, or if your blind pimples are severe, painful, or leaving scars, consult a dermatologist. They can provide prescription medications, steroid injections, or other advanced treatments. Blind pimples are frustrating, but with the right approach, you can manage them effectively. Consistency with skincare, a proactive lifestyle, and professional guidance when needed are key to clear, healthy skin.